Thank you for joining Cancer Support Community Atlanta for the COVID-19 vaccine and cancer, facilitated by Dr. Ronald Trible with Georgia Infectious Diseases and moderated by Dr. James Lennon with Georgia Cancer Specialists. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. If this is your first time participating, we invite you to complete a new attendee form to stay connected to all future programs.
Welcome everyone to today's program, the COVID-19 Vaccine and Cancer, featuring Dr. Trible and Dr. Lennon. I'm Katie Armsby, the Program Outreach Director with Cancer Support Community Atlanta. If this is your first time participating in a Cancer Support Community Atlanta program, we invite you to visit our website, cscatlanta.org, where you can see a complete list of the virtual oncology support programs offered. These range from virtual support groups led by licensed mental health professionals to stress reduction classes like yoga and Tai Chi, to monthly nutrition seminars facilitated by Northside Hospital Cancer Institute's Kristen Kukolowski, and education programs like these. If you ever miss a live event, you can find a recording under the video tab of our website, and again, that's cscatlanta.org. As a reminder, everyone will remain on mute for the duration of today's program. We invite you to enter questions into the program chat box, which Dr. Trible and Dr. Lennon will address during the Q&A, time permitting. I'm excited to present today's program moderator, Dr. Lennon. Dr. James Lennon is board certified in oncology, hematology, and internal medicine. Dr. Lennon was a fellow at Lake Canal Medical Center in Philadelphia and currently practices at Georgia Cancer Specialists. He has a special interest in prostate cancer, gynecologic malignancies, and hematological disorders, in particular myelodysplastic syndrome and myeloma. Dr. Lennon is a member of the American Society of Hematology and the American Society of Clinical Oncology. So with that, welcome Dr. Lennon, and I will pass it off to you to begin today's presentation.
Thank you, Katie. And I just want to say what a pleasure it is to have been asked to moderate this discussion on such a very important topic that's affecting us all today. And it's a topic that I discuss every day in my clinic, and I'm sure Dr. Trible does as well. We already have a number of questions. We're going to try to get to everyone's question if possible. And today we have an excellent talk by our special guest, Dr. Rob Trible. Dr. Trible's did his internal medicine and fellowship training at Emory, and currently works at Georgia Infectious Disease, and he's the medical director of the antimicrobial steward program at Emory St. Joseph Hospital. So Dr. Trible, thanks for joining us today for this discussion.
Well, thanks for having me. It's my pleasure to talk to everybody, and I'm looking forward to engaging in the community groups here, the members, and answering some questions best that I can.
Yeah. I think we have a short PowerPoint presentation that we'll start, and then we'll have some questions after the PowerPoint presentation, hopefully a good lively discussion.
All right, sounds great. Hello, everybody, and welcome, and thank you for joining us here. I just wanted to start off by going through kind of some basics of COVID and vaccines in general, and specifically the COVID vaccine, just to kind of set the groundwork for things, and then take on the questions as they come. So I wanted to start just with some of the statistics as of the end of last week. Of course, they're fairly sobering. We're up to now just about 30 million cases of COVID infection in the US. And we've had over 530,000 people died from COVID-related illness. It's a pretty big number. Sometimes it's hard to really stomach that number, that this has all happened just in the span of a year. Important to understand, though, are the survivors of COVID many of them do suffer from long-term complications, and this can range anywhere from chronic lung disease and folks that were severely affected with bad pneumonia, to kidney failure, blood clots leading to strokes. So there have been reports of some neurologic effects, so-called brain fog, and this long haul syndrome of kind of persistent fatigue that happens in some people. We're still trying to understand this. So there's a lot more to COVID for some people than just getting over the viral infection. Something important I think need to recognize is that vaccines work. They reduce disease, and just as an example, these are a handful of some vaccine preventable diseases that I wanted to highlight. And in the first in the 20th century, there were quite a few diseases that most of us have never seen, and that's great. And these are, we think, certainly in large part due to vaccines. Just some examples: smallpox, diphtheria, we don't really have in this country at all. Measles and mumps are greatly reduced. Let me get through the, sorry for that, there we go. Just got a quick overview of vaccines in general, how they work. The basics is vaccines are a way of helping to stimulate our own immune system to better protect us against infection. And the idea here is that, generally speaking, we introduce a small a sampling of a virus or a bacteria, in this case maybe a piece of a virus, introduce that into the body so that the body can create an immune response to it, in particular antibodies. And then these antibodies will persist and help set up a defense system to protect us from infection going forward. Over here, we have I'm sure many of you have seen this picture before of SARS-CoV-2 virus. And these these areas colored red here are these spike proteins, and these seem to be the key for infection of this virus into the body. They also are the key proteins for which, if we get a good antibody response to, and neutralizing antibody response to, helps protect us from infection. So these red areas are the areas, the parts of COVID that are used for the design of the vaccines that we have. So COVID vaccines are a little different than some of the other vaccines that have come before, because we've been able to take advantage of some of the new vaccine technologies available to us. This is a slide that was actually presented at a Senate hearing in September of 2020, discussing the different vaccines, COVID vaccines in development. And just briefly, the three kind of major types. One is protein-based. So essentially, you take the spike protein in this case and purify it. You usually have to kind of fuse it to what's called an adjuvant to help stimulate immune response to it, and then inject that in, and that's the vaccine. And one of the examples of that is the Novavax vaccine that's using that strategy. And this is a more conventional vaccine approach. But two of the newer approaches, one of them here is a viral vector-based approach, where you take essentially a shelled out cold virus and then replace the inside DNA with the genetic material encoding for the piece of protein that you want. So in this case, again, this is the instructions to make a spike protein are used in there, and that's just a way of delivering that information into the body to help produce an immune response. And I'll go into that in a little bit in a second. And then the one you've probably mostly heard about is this mRNA technology, which is very exciting. Similar idea, this mRNA is a piece of instructional molecule I'll talk about in a minute that allows the body to produce that protein and then create an immune response to it. The viral vector approach is Johnson & Johnson and the Oxford AstraZeneca companies are using this. And then the mRNA approach is being used by the Pfizer and Moderna vaccines. So in particular, I want to focus on mRNA vaccine and how this works. The basic biology or biochemistry lesson for everybody here. We have DNA, which is the main master blueprint, as I call it. It carries instructions for all the proteins that our body is going to make. Viruses and bacteria and other microbes also have DNA and use the same idea. From DNA, then there's this process of transcription to make an mRNA molecule. An mRNA is simply little smaller instructional molecules. The M stands for messenger. And so these messenger molecules then deliver instructions to make those particular proteins onto the protein creating machines of the cell. And then the cell then goes and makes that protein, as we see here. So in an mRNA vaccine, it's simply mRNA molecules, these instruction molecules that are put into the vaccine, delivered into the body, where the cell then sees this and then reads the instructions and creates a protein. And in this case, we've used an mRNA that instructs the cell to make this spike protein, not the whole virus, just this one protein on the outside of the virus, which is otherwise just by itself is completely harmless. So the vaccine introduces those molecules into the muscle cells in your shoulder. The cells then read that and creates that protein. Once the viral protein is made, it's then we use the term presented to the immune system, and the immune system then creates an immune response to it. And that includes antibodies and also T cells. The other technology we talked about is vector vaccine. So a vector is referred to here as a replication defective cold virus is what we typically use. And the most common one to use in viral vectors is adenovirus. And then the particular viral gene of interest, in this case, again, this COVID, this spike protein on the outside of the virus, that protein is incorporated inside the vector, at least the DNA encoding for that is put in there. And then the vector acts as a shuttle and then kind of works its way in and delivers that little piece of instructional molecule into the cell. And then the cell, again, same idea, creates the viral protein from that. And then the viral protein is created and you get an immune response to it. In this case, the vector, this kind of replication defective shelled out adenovirus is harmless. You can't get sick from that. The little piece of instructional molecule, the viral gene, is harmless, and then the protein itself is harmless. And at the end of the day, the idea is to create a good, robust immune response. And then once in the body, we talked about the viral proteins are recognized. This is just a very simplistic overview of that. You get a vaccine, hopefully you get a nice, good night's sleep. There's actually some data that helps with the immune response. And then you get this combination of antibodies and cell-based immune response. The idea is, like this cartoon, the cell then, the body then is trained, the immune system in particular is trained to look out for something. So it's essentially like the wanted poster, the FBI's most wanted poster. So the immune now is surveilling, looking for the COVID, this spike protein, which of course will be stuck on the outside of a COVID virus. And so now it's on patrol looking for it. And then if it sees it, sort of everybody gets recruited in to attack that. So how effective are these vaccines so far? Here's a table looking at some of the vaccines that have been studied to date. We see the Pfizer, Moderna, here's the Russian vaccine, Novavax, Johnson & Johnson, AstraZeneca, and the Chinese virus vaccine, the CoronaVac. And you can see they're all pretty effective, some drop off with this vaccine, which we could talk about at another discussion. But we're looking for vaccine efficacy 60% or north. And if we were able to get better than 60% efficacy on a vaccine going into all this, we were going to be really happy, and that's what we wanted to use. So we were really, really happy to get vaccines as effective as 94, 95%. So that's, I mean, really, really exceeded our expectations. All of these vaccines, though, 70% north, I would consider to be an excellent vaccine. And what's even more important is this vaccine efficacy is looking at protection against just getting sick at all, mild, moderate, severe. But if you look specifically at prevention against severe disease, including hospitalization and death, they were all in the clinical studies 100% protective against that. Nobody in the clinical studies who received the vaccine ended up getting hospitalized or dying from COVID. That number is likely to change. It'll probably be more like 99% or 95% in the real world as you introduce different people from all over. So nothing's really 100% in medicine. But these are extraordinary numbers. So these are really, really excellent vaccines. So globally speaking, worst case, even if you were to get sick from COVID after having been vaccinated, your chances of ending up in the hospital are extremely, extremely small. Something to understand about the spread of COVID, every person who's infected on average can spread it to about 2.5 other people. That number is, we still don't have it set yet, but it's somewhere between 2 and 3. Some of the new viral variants are a little easier to transmit, so that number may be closer to 3 for some. For instance, that B117 UK variant spreads pretty easily. So one of the really important things to getting vaccinated is to prevent yourself from getting sick. So if you don't get infected, you're not going to be able to spread it. The other concept that's really important, especially in the cancer community, is this idea of herd immunity or community protection. So I just wanted to go over this briefly because I get a lot of questions about this. Essentially, imagine you have a person here with COVID, this guy here or lady in red, and there's one group here that this person encounters, and this is a group of folks, this community here, that's relatively poorly vaccinated. So there's the 4 people here in blue that are vaccinated and well protected against infection, and the rest of the community is not. So when this person comes into the community, there's a decent chance that the first person that they're going to encounter is somebody who's not vaccinated. And that will allow that then to spread to other non-vaccinated people in the community. And this is how an outbreak persists or perpetuates. However, if you were to walk into a community where most of the folks are vaccinated, odds are that the first person that they'll encounter is somebody who is protected and won't get sick, and the virus stops right there at the door. So it is unable to spread through the community, and that infection is contained. So this is an important concept to understand. It's also important to understand, because I get asked a lot, well, you know, I'm one of these blue folks here that I'm vaccinated, so what difference does it make if my neighbors are vaccinated or not? I'm protected, right? Well, that may be true, but I want you to consider that this person here in the community has leukemia, and vaccines don't work very well for them. So what happens is that this person came into the community, and yes, this one got vaccinated, but not enough of his neighbors did. And as a result, this person with leukemia ended up getting sick with COVID. Whereas over here in this community, this person over here, for instance, maybe has Crohn's disease, or could be severe rheumatoid arthritis, or something for which they're on an immunosuppressive treatment. They should still get vaccinated, and they probably did, but he or she probably did, but she might not be able to mount as strong of immune protection against COVID. So she's going to really rely on her neighbors, community members, and family members to have to be vaccinated to help protect her. And in this case, she would have been protected. A final slide here, or close to final slide here, on mutations. I get asked a lot about this. There are 3 major variants that have been identified in the world. All of them, by the way, despite the fact that they've started in other countries, have worked their way into the US. These are of concern because it seems that folks who have had COVID before don't have great protection against these new variants. But fortunately, so far, the vaccines seem to offer pretty good protection. There's some recent data that may be a little bit iffy with the South African variant, but for the most part, vaccines are still able to give you good protection against these variants, but having COVID does not. And there's definitely very strong data for both the South African variant and the Brazil variant that folks who had COVID earlier last year are now getting sick again with these new variants. The vaccine, though, will offer some level of protection. It's also really important, though, that we vaccinate as many people as possible, as quickly as possible, to help keep these more variants from developing, because the next variant might be even scarier. And this means getting folks vaccinated, not only in this country, but around the world. We want us to be vaccinated, of course, but it doesn't help us very much if the rest of the world is not. And then as long as there's lots of circulating virus going around, variations will accumulate and continue to occur. And some of those may end up being, may be such that the vaccines don't work at all for that. And that could be a big problem for us. So we're all in this together. And most importantly, COVID vaccines are safe. Certainly considerably safer than the current COVID pandemic environment that we're in. There were no safety steps skipped in these trials. The vaccine trials, they were expedited. There was a lot of processing that was streamlined, and a lot of protections afforded to industries to take a gamble on creating a lot of vaccine before really knowing if it would actually work. All of this allowed us to very quickly get vaccines out, but the safety steps were not skipped. And in fact, there's ongoing safety evaluations as for any vaccine that will continue infinitum. I'll mention that there have been over 100 million doses of vaccine administered in the US already, and even more around the world. And it's been shown to be time and time again to be extremely safe. And the rare reports of adverse reactions are just that, rare. We expect about 1 in a million adverse events, reactions to any kind of vaccine, and the numbers may be along those lines, or might be even lower for this. This is very safe. These are very safe vaccines. As I mentioned, there are ongoing safety evaluations as part of the VA-ERS program. And then the last slide I put up here was a couple of just quick questions, but I want to engage more with you directly about cancer. So the first question is, if I have cancer, if I've had it in the past, should I take the COVID vaccine, and can I? And the answer is yes to all of that. If I'm on chemotherapy or other immunosuppressive therapy, can I still take the COVID vaccine? The answer is definitely yes. There may be some decreased effect from the vaccine. It won't hurt you, but you might not be able to make as good of an immune response to it. So you're still going to rely on your community members and family members to get vaccinated to help further protect you. And I would advise discussing the timing of the vaccine with your doctor. Sometimes if we can try to time it around your treatments to help maximize the effect of the vaccine. And then which vaccine should I take? All of them, any of them, whichever one you can. All of them are very highly protective at preventing against hospitalization and death, which is the most important part of the vaccines. And I'll leave you with this quote here from some of my colleagues and world-renowned vaccinologists, Walt Orenstein and Rafi Ahmed, that it's often said that vaccines save lives, but this is not strictly true. It's vaccination that saves lives. And a vaccine that remains in the vial is 0% effective, even if it's the best vaccine in the world. So I wanted to thank you, remind you all to continue to wear a mask, watch your distance, wash your hands until we have the circulating levels of virus down to much lower levels. These are my partners, by the way, Mitchell Blass and Margaret Williamson. We're at Georgia Infectious Diseases, and this is my information here. If you have any questions, just hop onto our website or give us a call. And this is my email address here if you wanted to send me any particular questions. And Northside Hospital is offering COVID vaccines now at several different locations listed here. And I advise any of you who have not yet been vaccinated, please go to northside.com/COVID-19 and make an appointment to get your vaccine. And just as a FYI, for those who aren't aware, as of today in the state of Georgia, anybody age 16 and over, regardless of their health status, is eligible to receive a COVID vaccine. Turn it over to Dr. Lennon.
All right. Well, thank you very much. That was a very informative talk. There's lots of information. It was excellent. And thanks again for providing us with those slides. So we also have we have a lot of questions already, and you know, the one recurring question theme that we seem to be getting over and over again is, you know, one is, how can I get my vaccine? And you did give us that information, and there's other places as well. And we have one person who says their wife is actually allergic. She's one of those people that's allergic to the components of the vaccine, and they're wondering, how do we find out? Is there a way to find out if someone's given the J&J vaccine instead of the Moderna or the Pfizer vaccine? And do you know the answer to that?
There's a couple of questions in there. Folks, there have been reports early on about folks who've had severe reactions to other vaccines, having reactions to some of the earlier vaccines. It comes down for the Moderna and Pfizer ones, it's the lipid components. So I'll say that those vaccines are extremely pure. They're kind of the purest vaccines we have. They include an mRNA instruction molecule. They include some lipid proteins to help protect that molecule because it's very fragile otherwise. And then sugar to balance pH, I think it is, and then salt water to allow it to be injected into the arm, and that's it. Folks that are going to have a reaction to that are folks that have reaction to the lipid component, sometimes to the PEG, polyethylene glycol. And if you do have a particular reaction to that, that's something you want to talk to your doctor about. Maybe avoid that one. Other vaccines, the vector vaccines, may still have some component of that. Actually, I have to look that up to look at the details of what's in there. I think that traditional vaccines, allergies to traditional vaccines, you probably won't have as reaction to this one. Even if you do have a small reaction to it, you don't need to let your doctor know about it. Talk through that. Maybe be prepared to have some Benadryl nearby in case you do have a reaction. And we advise folks that have any kind of reaction to prior vaccines to hang out for about 30 minutes instead of 15 after receiving that shot to make sure there's nothing untoward about it. All the folks that have had reactions so far, they've been managed appropriately and have done fine. And now they're going to have protection against COVID. I really don't want those folks getting COVID because they're probably going to have a pretty severe reaction to that.
Yeah, absolutely. And then because we know that we can go to northside.com/COVID-19 to schedule an appointment. Yeah. But what about those people who are homebound or who have significant transportation issues? Do you know of any programs that might bring the vaccine to them? Is there any home health agencies or anything?
That's a really good question, actually. Yeah. I don't know the answer to that.
That's a really good question. And I did not know the answer to that right off the top of my head. So, I'm sure there's plenty of people in that same situation.
No, it's an excellent question. I'm jotting that down, and I'll have to circle back, and I'll circle back with Katie if she has a way to disseminate that. But if that particular person had that question, let's email Katie or me about that. We can get back to him.
Yeah. And then so this is a sort of is this a brand new technology, or has this technology been around for the mRNA vaccines?
So mRNA's technology has been under investigation for, I think, about 15 years now. And it's just kind of got to the point where we had an opportunity to use it. mRNA technology has also been used as part of cancer treatment studies. So there's some research involved in that. I think there's some promise in that for sure, for developing essentially cancer vaccines. This was the first major opportunity to employ the mRNA vaccine technology in this type of scenario in such a grand scale, and basically it's shown to be extraordinarily effective. And I truly anticipate that this will be the model going forward for a lot of our future vaccines.
Yeah, it's definitely very exciting.
Yeah.
Yeah.
And then it's what's really nice about it. It's easy to do. It's easy to make. You can change it on the fly. And in fact, Moderna's already doing that. And they're having an updated version of their vaccine that will protect against some of the variants that are coming up. I fully anticipate us maybe even having a booster in the fall or the winter that will afford us additional protection against the major variants around at the time.
And I know nobody can predict the future, but how would do you foresee this becoming like going along with the flu vaccine, an annual vaccine that we have to get every year? Or
I think it remains to be seen. My guess is probably for the first couple of years, maybe, yeah, until the circulating levels of virus go down. This is a fundamentally different virus than influenza. Influenza is ever changing, and the outer surface of that is very complex, and it's almost like a new virus every year. Coronavirus, it's pretty limited in its ability to change its outer structure. So that spike protein really is the key. So there really are kind of a finite number of changes that can be made to that protein before it just runs out of options. So I don't think it will end up being 10, 15 years from now, we're getting a COVID vaccine. I don't know for sure, but it remains to be seen, but probably not.
Yeah. And when we get, I know the studies haven't come out for the long duration, but when you get the vaccine, is it expected to have a long effect, or are we immune to it for a long period of time?
Yeah, well, we hope so. Again, that remains to be seen a little bit. It depends in part on whether you're getting depends on a lot of different factors. I'll say that so far for the Moderna looked at 3 months in, and they looked at antibody levels 3 months after vaccination, and it was pretty flat curve, which is good. It wasn't going down. And the projection is probably about a year or so at least. We don't really know for sure, because the very first person to get vaccinated in the first trial got vaccinated in March of last year. So it's been just 1 year for the handful of people. The majority of the population in the trials were vaccinated in July and August. So most of us haven't been vaccinated for even a year. So the real world actual data to know for sure, we don't know. We just have projections. Yeah. So we'll have to kind of wait and see on that.
Yeah, definitely. And then we have one quick question that was that we did you touched on this on your slides as well, and they're making sure that the vaccinations are backed by the FDA. Yeah.
Yeah, and they're right now under what's called an emergency use authorization, and that can cause some confusion. It's just more of a process thing. These are evaluated very heavily scrutinized by essentially really smart doctors and scientists that really know this. They do this day in and day out, and have poured through the data, and say, yeah, this is a safe vaccine. This is an effective vaccine. This is something that we need to get out now, because withholding it would be a detriment to our society, to our people. So that vaccine is out. It's doing great. I'm really excited for that. The more formal processes will go on, and it'll be established as a definitive, yes, this is a formally recommended vaccine. But this is something we need to get going, and we're doing well so far, but we have a long ways to go.
Yeah, definitely. Yeah, we need to keep it up for sure. And then this is about cancer and patients on cancer treatment. So the question I always get is, people have read a lot of articles about, you can't take Tylenol or ibuprofen around that. So why would I take the vaccine if I'm on chemotherapy? And the timing around chemotherapy, and should I wait to get my vaccine? We talk about that every day.
Yeah. Yeah, and that brings in a couple issues. First of all, it's no problem taking chemotherapy aside. If you get your vaccine, want to take Tylenol for that, that's fine. A little ibuprofen will probably be fine as well. Chemotherapy, if we're able to kind of time it around that dose, that's fine. Sometimes we can do it, sometimes we can't. But I'll also caution that for the most part, folks on chemotherapy are, hopefully are already being fairly careful about their exposures to infections in general. So I kind of expect those folks to take a little additional precautions and not be, racing out to join a whole crowd of people at the beach while they're on chemotherapy. It's just too risky. I would say that if those folks feel pretty comfortable that they're able to kind of quarantine themselves and stay pretty well protected, that they could hold off on getting that vaccine until they finish their chemotherapy course and then get that vaccine and get a little more durable protection. I think that's fine. I think, though, if the opportunity presents itself to get that vaccine, if there maybe not an end in sight for chemotherapy or a definitive end in sight, go ahead and get that to get some protection would be reasonable, and then kind of circle back and look for a boost once the chemotherapy regimen is completed. I fully expect there to be some sort of a boost recommended later in the year anyway. Certainly as an infectious diseases provider, I would think that would be reasonable to do in that situation regardless.
And would you find any utility in saying, well, it's your white blood cell counts will be low at this point, so we'll wait till your white blood cell count comes back up before getting?
Maybe, yeah. I would try to have the immune system in the best possible place before giving a vaccine when we can, if we have the luxury of doing that. Yeah. The vaccine's not going to hurt if you give it with a low white count. It just might not be very effective. You just do the best we can. Immune system is pretty complex. It's going to drive antibody and T cell protection once you get the vaccine. Kind of need different parts of that all working decently well for all that to get a good response. I don't know anybody's gonna be able to tell you what number to look for, what white count, what neutrophil count, is the acceptable number. In my HIV population with low CD4 counts, we try to wait till they get up over 100, maybe 200, and sort of depends how they're doing. But at some point, I give them the flu shot every year, even if their counts are low. They just in the hopes they get some semblance of protection from it.
Yeah. In the cancer world, their cancer patients typically have other comorbidities as well, and some of them are autoimmune diseases. And we'll have quite a few people on Plaquenil, and sometimes they're just in surveillance, and sometimes they're actually on treatment. And would you recommend the same type of vaccine, receiving the vaccine while on Plaquenil and those types of things?
Yeah, Plaquenil, methotrexate are two medicines we see a lot. In my world, I don't consider them necessarily strong immunosuppressants. They have their immunosuppressive-like activities, but they're not anything that would dissuade me from giving this vaccine. So especially our folks that are going to maintain for years in these medicines, definitely go ahead and get the vaccine. I wouldn't hold the medicine for that.
Yeah. And we also have a lot of questions about they say, well, what side effects can I have? I know we have the fevers and chills. Are there any other side effects that you've seen?
A lot of my patients get a sore arm. Some folks get a little rash. My cousin actually got that. She sent me pictures, and then I sent her pictures back of a recent letter in the New England Journal of Medicine that displayed the exact thing, a bunch of pictures of people with sort of a little red area on their arm, and they get better. It's fine. It goes away. It's nothing to be concerned about. Typically it's fatigue, just kind of feeling a little run down. It can be up to fevers, 102, 103. I had one of my colleagues from medical school who called me and said, oh, I had teeth chattering chills for a night. Then the next day felt completely fine. I personally felt pretty run down for about 24, 36 hours. And that next day felt great. So it could be a little confusing or concerning for some of our cancer patients if they were to feel those symptoms, thinking, oh, maybe I'm sick or something. But I think to expect that these shouldn't last more than a day or two, maybe 3 days. It gets really unusual for those effects to go beyond that.
Yeah, I had the same experience as you did. I was pretty run down and fevers and chills, shaking chills, but then it went away and I was fine.
Yeah.
So, and then We have one participant who's asking a question about a numbness on almost like a numbness on the side of their face. As after I would probably encourage that person to maybe talk to or seek some medical care to make sure it's not something else, because I've never heard of that as a vaccine side effect.
I don't think so. There's talks of things like Bell's palsy which may be related to an immune reaction, but I'm not regarding this vaccine that I've heard. I think that I had somebody else say, I've got some tingling in my arm that after my second shot, and I feel like my arm's trying to go to sleep, and we kind of dug into it a little bit more, and it's like, yeah, it's positional. It depends how I sleep. And I'm like, well, I have the same problem actually, and it's nothing to do with the vaccine. And so there's going to be things, if you really kind of trying to look for things that you could maybe try to temporarily associate with that vaccine that have nothing to do with the vaccine. I can tell you these are really, really, really safe. And I can tell you that any true vaccine-related adverse event is exceedingly rare, at 1 to 1 million or rarer. And we're seeing that borne out now. Like I said, we've already had over 100 million doses given in this country and far more around the world. And we're just not seeing these effects. And if you're going to have a side effect from the vaccine, it's going to be really pretty quick, pretty much within usually within 15 minutes of getting the shot. We just don't see these reactions days, weeks, months later.
Yeah, and females of now we can vaccinate everybody from 16 and older, and some females might be concerned that it might affect their fertility. Have you heard? I haven't heard anything about that. Have you?
There was a spurious report that was immediately shot down about concerns about the effect on fertility, and it's unfortunate sometimes some stuff ends up in our world of you can post anything anywhere. There has been some reports of things that are just untrue. There's no evidence, there's no data or nothing, no suggestion at all that there's any harm for that. In fact, we're actually encouraging folks to protect themselves before they get pregnant, or even if they are pregnant, to protect themselves from getting COVID, because really the worst thing that can happen to you if you're pregnant is to get COVID and end up in the hospital with one of these severe effects, and that could definitely put your child at risk. The American College of Obstetrics and Gynecology has recommended the vaccine, and there were several people in the trial, I think up to like 38 or 39 people in the trial that became pregnant after getting their vaccine that had done totally fine. And they're continuing, there is now a formal study looking at folks that are pregnant or looking to become pregnant, and the vaccine to kind of definitively say this is a safe vaccine to give. We have zero evidence that it causes any harm. All the suggestion in the world that it's perfectly fine and in fact good to get it. And the last thing I'll say is that we give vaccines to folks in pregnancy all the time. We give a Tdap during the 3rd trimester. Again, if it's your 5th pregnancy, you get your 5th Tdap during that 3rd trimester. And the point of that is to help pass antibodies on to your baby. And the new baby is wholly reliant on mom's antibodies for the first 6 months of their life before their immune system develops. The same thing will apply with COVID. So that baby will have 0 COVID antibodies unless mom has had COVID vaccine.
Yeah. We have another question that we've already touched on this a little bit about the Tylenol, taking Tylenol around the time of the vaccine, and we said that would, is reasonable and it should be okay.
That's fine.
And sort of going back to our cancer patients, when we talk about treating cancer patients, nowadays we have more than just our traditional chemotherapy. We have radiation therapy, and we also have immune therapy. I know that for a period of time, there was a lot of talk about, not giving the flu vaccine when someone's on immunotherapies because of potential risk of side effects. And I know there's been some back and forth with that a little bit. And what about, do you have any thoughts or any words of wisdom on someone that's receiving Keytruda? Or
yeah, that's an excellent question. It's another difficult question. It's a good one. It's a very good, thought-provoking question, I'll tell you that. I honestly would talk to your provider. I hate to kind of go back to that, but if I was having that discussion with my patient, I would still say to get the vaccine. I'd say I would expect that you might have a little more of a higher chance of having that reaction to the vaccine, especially the second one. that might be a good opportunity even to consider doing the one-shot vaccine to kind of, because that's less likely to promote that immune reaction than having the 2-dose prime boost, because it's really that booster shot that really hits people with that the vaccine-related reaction, immune reaction. So that could be something to talk about there. At the end of the day, it comes down to trying to get folks as protected as they can against COVID. Again, this alternate possibility of a person on Keytruda getting COVID could be devastating for them. So, you know, I would want to maximize their protection. So I think a vaccine probably would be reasonable, but yeah, I would definitely run it by their oncologist. And if the oncologist has questions, they should, you know, give me a call or give another ID physician a call and kind of talk it through case by case.
Yeah, I've been I've been having the same discussion with my patients, and it's always been you know, we always talk about the risks and the benefits, and from at the end of the discussion, we always seem to find that the benefit always outweighs the risk, and we just, as long as we're aware of the risks and benefits, we monitor for it, we can I think, you know, my feeling is we could most likely get it done safely.
How's it worked out so far with your patients getting other vaccines?
Yeah, I haven't had any issues at all with it. So, you know, and so it's very lucky. And so I'm encouraging my patients to still do the COVID vaccine, because as we know, the patients with cancer, if they get COVID, which is, you know, they are the higher risk group. So we definitely want to protect them in that way. So,
and I agree with you completely. So,
yeah. And then we have another interesting question, and it's about autoimmune diseases. And is there any evidence that the vaccine could be causing anyone or anybody with autoimmune diseases? Could the vaccine be causing any issues or bringing on an autoimmune disease, or if they have one, would it make it worse?
We don't have anything to suggest that at all.
Yeah.
And there's no known link between vaccines and autoimmune diseases. There have been, we could talk about some of the historical issues and a lot of the discussions about that, and that would be kind of a whole nother talk.
Yeah.
But no.
Yeah. And then here's another quick question is about, if I got the Pfizer, could I get the Moderna for the second shot, or should I stay with the same brand?
So we recommend you stay with the same brand. I'll tell you that probably doesn't matter, but we recommend staying with the same brand. So if you can, please if you got Pfizer for the first dose, I would get that for the second dose. And if you got Moderna for the first dose, get that for the second. If you end up in a situation where if you got Pfizer first and there's no Pfizer available anywhere, and it doesn't seem to be in the foreseeable future, then I think it would be reasonable to go ahead and get that Moderna as the second one. But there should be enough of all those vaccines around that shouldn't be an issue.
Yeah. And then as we move through, like for, you know, patients with radiation therapy, I've been encouraging my patients, even on radiation, I don't feel like it's that immunosuppressive. They can continue.
Definitely get it. Yeah.
And then we also have the other group of patients with the bone marrow transplant patients. That's becomes more of a difficult question.
Yeah, and that kind of leads to my slide of herd immunity or community immunity. Those folks really need to rely on folks around them. And I had a patient here, lymphoma, was on some medicines. His immune system was probably not going to help him a whole lot with the vaccine. He got the vaccine, but we're not sure what kind of response he's going to have. And I said, look, you really need to make sure that everybody in your family and in your friends and your local community gets their vaccine to protect you. The bone marrow transplant team does a pretty good job with their counseling their patients about vaccinations and when to do that. So follow along with those suggestions and recommendations. But yeah, certainly anybody in that category needs to really heavily rely on people. So those folks, I say, get on. And I told my patient too, I said, get on Facebook. Tell them, please look, I can't rely on vaccine protection. So please, I need you all to do it to protect me. So please get on Facebook and tell your community to please get it for your sake. Go to church or your synagogue and your mosque and tell folks, please, help protect me by getting your vaccine.
Yeah, this is a chance for everybody to be a hero.
Absolutely. No, absolutely. The only way we can confront this pandemic and end it is for us, all of us to get together for this. I mean, the scientists have done their job and created an excellent vaccine. The doctors are here trying to educate patients about it and deliver that the best we can. But ultimately, it comes down to the folks in the community stepping up, doing their part, and getting that shot.
Yeah. And then once I get my shot, and people ask, well, I'm vaccinated now. Can I still be an asymptomatic carrier, and do I really need to wear a mask?
So good question. Couple of questions in there. First thing is, yes, right now you definitely need to continue to wear a mask, social distance, hand hygiene. We need to do this until the circulating levels of virus are down. So the vaccine is a way to help further this. If everybody wore a mask and social distance, if everybody did that, that would be enough to end the pandemic. Practically speaking, obviously that doesn't happen. So we have a vaccine that will give us additional protection against that, additional way to help kind of to prevent transmission and end this pandemic. It's an additional layer of defense against the virus. But we still need to do that until the levels are down low enough. And once the levels are down low enough, I think at that point, maybe having an additional layer of protection like a mask may not offer that much more protection at that point, but that discussion remains to be had. I'm hoping we'll get there by, as far as the community level, by the summertime. I will say the second part about this is that we still don't have the hard evidence that the vaccine does decrease transmission. I'm going to tell you that it most likely does, but the studies were not designed for this. So we're collecting that data still to kind of prove that being vaccinated means you can't transmit it. Now, could you possibly? Maybe. And one of the things I remind my patients is that the vaccine does not provide a force field against the virus. So the virus will still be able to enter your system. So you're vaccinated and you encounter somebody that has COVID, that virus will get into you, into your nose. But because you have the vaccine and antibodies to the virus, you're going to mount an immune response almost immediately to that virus. So your body's going to see it quickly. It's going to know to look for it. It's going to be ready to go after it. And it's very quickly going to go after that virus before it has a chance to replicate to the point to make you sick. So that's how these vaccines work. So that's why 94, 95%, 70%, whatever, are not going to get sick at all, because their immune system is going to respond very quickly to it before the virus has a chance to take hold. Now, is the immune system going to respond in time to prevent the virus from then being spread to somebody else? That's the question we don't really know. The presumption is probably, because it seems like it probably takes, the level of virus it takes to make you sick is probably lower than the level of virus it takes to spread to somebody else. We don't really know the exact numbers yet. They're pretty close, but we'll know the answer to that later. But we do want to continue to assume, yeah, I could potentially spread this to somebody else. So if you're in that situation where you're out in the community, you don't know if you're going to encounter somebody that might have COVID, you definitely want to wear that mask, continue social distance. Now, that conversation is different when you're talking about people in your family or local community friends that you know are vaccinated. So if you know these folks are vaccinated and you're vaccinated, hey, you guys can get together, have dinner, have drinks, give them a hug. You know, that's you can do that. So we can do that safely. And if there's a member of the family or community that is not vaccinated for whatever reason, either they're not eligible or not able to, but they're relatively low risk, like really low risk for having COVID, not out in the world being exposed to it and have taken the right precautions and worn their mask and social distance, we consider them very low risk. You can have them over as well. And CDC's updated their guidelines a couple of weeks ago about this. You can go to their website and kind of delineates that exactly what I'm telling you. So if you're vaccinated, you can hang out with other vaccinated folks in an enclosed setting, absolutely. But right now, because there's such high levels of circulating virus in the community, you just have to assume it's going to be out there when you walk out your door. So you want to continue to wear your mask and social distance until those numbers come down.
Yeah, exactly. And so because we just don't know yet, we still all should be wearing our masks and doing all the safety measures that we can. And also, you sort of touched on something that we need to, I was hoping that we could really drive home is, our cancer patients really is, they're it's a vulnerable population to it. And, having their little circle of friends or their family, they're make sure they're vaccinated. So have a little vaccination bubble to protect them as well. So important. So as much as they can encourage their family and friends to get vaccinated, that would be very helpful. for
It
them.
would, and it would also allow them to come over and visit and spend some time. It's something, this social interaction we've been missing out on for such a long time now. It's so important for people, and this is the opportunity now to safely congregate. I've talked to several of my patients about that. They're finally able to have close family members come over and visit for the first time in a year, and the vaccine allows us to do that.
Yeah, definitely. Social interaction is so important, and social support, especially in someone with cancer.
Mhm.
And then we always, a question that I always have coming up in the office as well, is almost a daily discussion as well, is about imaging studies. They've read things about imaging studies and when should they get done, and should I get my mammogram after my vaccine or before my vaccine, or my PET scans, is it going to interfere? And there's some interference there, and but the importance of those tests are still very important for the patient's care. And do you have any other thoughts about that? Or
Yeah, and it's so this comes from the idea that if you get a vaccine in your arm, that as part of the immune response, the normal immune response to that, you may light up a lymph node, a draining lymph node in that arm. And that might light up on a PET scan, or might be, sometimes could even be, you can feel it as a lump for a few days or so, or even a week or so after the vaccine. That's totally normal, but it might show up in somebody where, if you're concerned for cancer or has cancer, it might be concerned that, oh, maybe that's the cancer. So that's where this is coming from. I mean, this is, you just have to be, open with your doctor about it, your radiologist. Say, hey, just so you know, I had my COVID vaccine here last week. So if you see something on that side, that's probably what it is. And I think that with that information, that your radiologist and oncologist can make a pretty reasonable a guess or an assumption about what that spot is. And if there's obviously major concern, you just repeat it later on when the vaccine effect should be gone. I would not delay your vaccine because of those concerns, though. I would just inform your doctors about that and involve them in that decision. But we don't need to delay the vaccine, but we also don't need to delay the imaging. And one of the biggest concerns we've had during the COVID era is the delay in people seeking medical care for medical problems, and seeking and getting the imaging and the cancer screening done that they really need to have done. And we're afraid we're probably missed a lot of cancers, and we'll have some delayed diagnoses as a result of this. So we definitely, can't afford to have any more of that. So if you're due for your mammogram, please get it. Even if you just had your vaccine yesterday, get that mammogram if that's what's advised by your doctor. And if you need other screening exams, please get those done. We have to get back on track because at this point, we can, with vaccine, that'll help us with COVID. We still have a lot of other medical issues that have not stopped, that we need to continue to surveil for and diagnose and treat.
yeah, I couldn't agree with you more. And then what about surgeries? We have if someone's having their surgery, they're wondering how long after their second vaccine should they get surgery?
I would say there's really not really a reason to delay it. I would say it's reasonable to wait 48 hours, just because you're most likely, a lot of folks are going to have that after that second dose, have that reaction to the vaccine, may have fever, chills, and most surgeons aren't going to want to operate on somebody that has a fever. So I think it's reasonable to just maybe wait a couple of days after that. I will say that if it's a very needed surgery, necessary surgery, and it kind of has to be done right at the time where you're due for your second shot, you may want to actually consider delaying your second vaccine until after the surgery is done. And that's a strategy that we've used in certain cases, and I think that's very reasonable to do. And there's some suggestions in the field that maybe that's not a terrible strategy in general in certain cases, to just kind of do that second dose a little bit later. Certain nations have done this by choice as a way to better vaccinate. But so talk to your doctor about that, talk to your surgeon about that. If you can kind of hang out for a couple of days and do the surgery a few days after the second dose, that's probably ideal. But if you really need to have that surgery done, I'd rather you just delay the second dose and do it a little bit, as soon as you can, safely after surgery.
Yeah, exactly. And the other thing is, people's already had surgery, and breast cancer surgeries, they have lymph nodes removed and they had cancer on the right side. Should I get my vaccine on the left side? If it wouldn't be unreasonable to put it on the other side, but do you have any feelings on which side it gets if they had surgery? Or
you tell your patients for other vaccines?
Say that again.
What do you tell your patients about other vaccines?
I use the same. I tell them I don't worry too much about which arm it's in. And if they have a lot of lymphedema, I would recommend the other arm. But other than that, yeah, it's
it's common sense. Yeah, I agree with that. You know.
Yeah. So yeah, and then all right. So and the one question is there's a few questions about, is there any one particular cancer that patient that shouldn't get the vaccine that has active cancer? I know we talked about the stem cell transplant patients, but if or the leukemia patients.
Yeah, I it's a case by case basis. It depends more so on the level of immunosuppression that the patient's experiencing. Again, these vaccines aren't going to hurt or in any way interfere with any of that. It's just a matter of, are they going to derive benefit from having that vaccine? And I think it's talking to your doctor about that, about the status of your disease and the treatment that's necessary for that to make that decision.
Yeah. All right. Well, thank you, Dr. Trible. It's an excellent discussion, and really enjoyed it.
I have one question on here. Looks like about checking a titer after the vaccine. We don't recommend doing that. For many different reasons. The main reason, the simple reason, is that the studies are pretty clear the vaccine works, and it doesn't really matter what the vaccine level is. When you're seeing numbers 70%, 94%, 95%, this vaccine works. So some people may have detectable antibodies. Most people probably will. Some people might not, depending on the commercial test you're using. Some of them might not be able to detect certain antibodies to the vaccine, because remember, the vaccine's against one protein, and the commercial antibody test may look for antibodies against other proteins of the virus. So we don't recommend it. It's not going to change what we do. We just know that forget about the testing, the vaccine works. So.
Yeah, so to drive the point home, we need to make sure we get vaccinated.
Yes.
Yeah. Do you have any other final thoughts or any?
I think I'm really thank you for letting me have this opportunity to talk to everybody. These are some excellent questions that were asked. If there are other questions that you have, please pass them on to Katie or to me, and I'll do my best to answer them in as timely fashion as I can. I think that this is such an important conversation to have, and I encourage all of you to continue to extend the conversation by having this with your family and friends and community members, and help us spread the word of how important it is to get folks vaccinated. It's the only way we can end this pandemic.
Yeah, absolutely. And thank you very much. And this was an excellent talk, and I'm sure we all learned a lot. And Katie, do you have any other final remarks?
Thank you both for such a great conversation. Thank you to all the participants for entering in their questions. I don't think so. As we wrap up, I want to remind everyone that a recording of today's program will be available on our website. Again, that's cscatlanta.org under the videos tab. And we did have a participant enter a resource that was found on the Georgia Department Public of Health about their teaming up with the local area agencies on aging to connect seniors and homebound patients to some of those vaccines. So you can visit their website, dph.georgia.gov, and that might be a resource for that. So thank you again, Dr. Trible. Thank you, Dr. Lennon. If you want any additional information about Dr. Lennon, you can go to georgiacancer.com, and for Dr. Trible, georgiainfectiousdiseases.com. Thank you both, and thank you guys for joining us. Take care, and we hope to see you soon.
Thank you.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.